Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us. The pandemic has caused a projected delay of more than 22 million screening tests for cancer right here in the United States. That means many missed or delayed mammograms. Well, Grammy Award-Winning Artist and breast cancer survivor Sheryl Crow is joining us here, joined by leading OBGYN Dr. DaCarla Albright. They're going to talk a little bit about why women should prioritize scheduling their annual mammograms. Welcome both of you to Health Professional Radio this morning. Thanks for joining.
Thank you. Thank you.
Well, Sheryl, we've spoken before on this very issue. You're a breast cancer survivor yourself. Give us a little bit about your experience and why you're so passionate about women taking care of their breast health.
Well, in 2006, I was in my early 40s. I was super fit, ate well, had no family history, was not at all worried about ever having a cancer diagnosis. And I had a routine mammogram set up, which I thought, well, I'm going to put this off. I'm super busy. But I decided to go ahead and just tick it off my list. And it turned out that I was diagnosed with invasive stage 1 breast cancer. And it really changed the trajectory of my life, but I was forever grateful that my gynecologist said, look, you have an abnormality, don't wait the 6 months that they recommend, go ahead and have a needle biopsy. Mm-hmm. And it really was a life-changing moment for me.
Had you been interested in your breast health prior to your diagnosis?
You know, I think we're really susceptible to kind of getting about our lives and feeling like we have everything in control and feeling like if we eat well and if we're healthy and we do everything right, that how would we ever wind up with cancer? And I think the statistic is still 1 in 7 women are diagnosed with breast cancer. And, you know, my message is always that until there is a cure, early detection is so important. You know, I'm always speaking to women who are in this strange breast cancer club of strangers that find each other and who share our stories and are constantly telling other women, please make sure and observe your yearly mammogram after the age of 40.
Dr. Albright, what should women know about breast cancer screening with so many projected screenings to be missed?
Well, I think the first thing that women should know is that it's important to make sure you get your screening done. I personally recommend annual screening at age 40. I know there are different governing bodies that have different recommendations, but I think what's been most successful for me in my practice is recommending that my patients 40 and over screen annually. That's how I've been able to detect patients earlier. And also, I prescribe a 3D mammogram. 3D mammography is going to be the best screening technology for breast cancer detection, regardless of any breast density a woman may have. It's going to decrease the risk of her getting recalled for like a false positive finding on a mammogram, and it's also going to further decrease the risk of an unnecessary biopsy, which can cause anxiety and quite frankly, discomfort.
Now, prior to the pandemic, there was a concern with annual mammograms, things of that nature, long before the pandemic struck. What, in your opinion, was the hesitancy to getting screened? I mean, screening is not invasive, is it?
Screening is not invasive, but for any given woman, they will let you know that screening is not necessarily always comfortable. Women are variable in terms of breast size and volume, and I can attest to the fact that a mammogram is not the most fun imaging study to have, but I do think it's really important that patients know that few seconds of discomfort per breast, literally, it's only a few seconds to a minute, could make the difference in your life. So to me, it is worth the couple of minutes of discomfort every year to have either the reassurance that it's negative or to then have the knowledge, if it is not negative and further action needs to be taken, that you get a diagnosis early, and that can save your life. And as Sheryl has attested to, you know, that changed the trajectory of her life, and it's hard to imagine, you know, not wanting to have that news so you can act on it sooner and be around for yourself, your family, et cetera.
Sheryl, have you been able to talk with women who have been inspired by your story and your message of proactivity?
Yeah, you know, I'm really blessed that I have a pretty wide span of women who are of all different ages. You know, I'm playing to women now that are my age that have kids and grandkids. I mean, obviously, I'm in my late 20s, but but yes, you know, it's not a position I would have chosen, but certainly I'm humbled by the fact that I do get to speak on behalf of what I feel like is a very important issue, and I'm blessed to have a built-in audience of women who, you know, if there's one woman that says, well, maybe I should do this, if there's one woman who winds up being diagnosed with an early stage, then I feel like, wow, what an amazing gift to be given, that maybe, you know, I can inspire someone to take care of their breast health. You know, one of the greatest analogies I can think of is when the flight attendant comes on the plane and says, you know, will you put on your oxygen mask before you put on your child's? And it's so metaphorical for the way life works. Unless we take care of ourselves first, we can't take care of other people, particularly our loved ones. So really want to encourage women during Women's Health Awareness Week to, you know, be proactive.
Doctor, a woman has missed her scheduled mammogram due to the pandemic, for obvious reasons, the fear of the virus. But now that things are looking a bit better here in the United States, what advice do you have for the women who've missed their mammograms due to the pandemic and may still have that lingering apprehension?
Don't linger. No more apprehension. Get that mammogram scheduled today. That's my advice. There's no need to have any further delays. Radiology centers are safe. They're practicing CDC guidelines. They have systems set up to make patients feel comfortable getting in and out of that wonderful mammography exam. So don't delay it any further. Get it scheduled.
Now, we've been hearing quite a bit about adverse reactions to the vaccine. You know, going back and getting that mammogram after a vaccine. Are there any misconceptions? Anything that you might want to clear up about some of that fear?
Yes. So I think many women believe that they cannot have imaging or they have to delay imaging. Mm-hmm. In the case, if their mammogram has already been delayed due to the pandemic, most radiologists will agree that the patient should just go ahead and get screened. If screening has been up to date and current and the patient has had a recent vaccination, mm-hmm. she should let her radiology center know. Sometimes they will delay it by a few weeks just to prevent any false positive finding on the mammogram, but it also gives the radiology center the awareness that the patient did have the vaccine when they're interpreting the images. I think talk to your doctor, talk to your radiology center, get the screening done. Just don't delay it any further.
Sheryl, when you were initially diagnosed, obviously there was some internalization that had to take place. Briefly talk about how you handled that initial diagnosis and what would you say to women in dealing with their initial diagnosis when they hear that news in the doctor's office?
Yeah, I think for most women I've spoken with, the experience is one of, obviously, you're terrified. Even if it's an early diagnosis, you feel like, is this something that's going to follow me for the rest of my life? Mm-hmm. And the other thing is that when you're diagnosed, your whole community of people, your family, people that you work with, friends, feel that diagnosis as well. Not only does it sort of bring to the forefront your mortality, but also it creates sort of a helplessness in everyone, and everyone wants to come forward and try to help you. And, you know, there's a real learning curve when it comes to having a diagnosis that is known as something that's life-threatening. I always encourage women to try to keep things as normal as possible, do the things that you do on a daily basis so that you feel like you're still in your life, because there is this sort of endorphin overload that kicks in that makes you feel like, I don't even know what I'm doing, you know, and you do get through it. You power through it. You know, women are notorious for being able to handle a lot of things all at once. You know, that's one of the reasons that we wind up in the situations we wind up in, is that we are so good at taking care of everyone but ourselves. And that is one of the lessons for me that came out of diagnosis, was just following up with a yearly mammogram, which I did not feel like I needed, nor did I really want to hassle with it, was a turning point in my life. And for women who are afraid of the diagnosis, afraid that they might find out they have something going on, knowledge is power.
Where can our listeners go online and get some more information about being proactive and about breast cancer in general?
I recommend to women to go online and look at Genius 3D Near Me. That's where you can find the nearest 3D mammography. And, we have not found a cure for cancer yet, but our technology keeps getting better and better. And this is state-of-the-art. It rules out false positives. So go to genius3dnearme.com.
Well, Sheryl, Dr. Albright, I appreciate both of you joining us here on Health Professional Radio, and I'm looking forward to speaking with you both again.
Great. Thank you.
Great. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Sheryl Crow and Dr. DaCarla Albright. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.